There's a popular account on Twitter. Well, name withheld. No, not name
Name
withheld.
withheld.
Not name withheld. No, not name withheld. Not name withheld. Not name withheld.
Hi, everybody. My name is Seraphine. Thank you so much for joining us today. Nasiba is not here. I'm going to be here alone. There's a one-on-one session that's happening right now. So stick and stay. We're here to talk about the topic that has been all over our feed since we started this podcast. People have been bashing us left and right. However, we're not going to listen to my worst day. We're here with a technical expert. His name is...
Roger. My name is Roger, and I'm a medical doctor. I think I'll keep it at that.
Yes, so I think that's enough. The fact that he's Roger, the medical doctor, is enough for you to pay attention. Anyways, we're here to talk about PCOS. The first time we posted the first episode, actually, the first episode we posted was about PCOS because there was a trending discussion online about Amabella, an influencer who said she had lost some weight, and she mentioned the fact that she was dealing with PCOS and she had used a GLP-1, Monjaro, that's the brand, and there's a lot of reaction online, and we decided to talk about it from our perspective, and we shared certain opinions as well. And there has been some feedback, pushback, reaction, whatever it is, and we want to hear from somebody who's qualified to talk on the topic or speak on the topic, and that's why Dr. Roger has joined us here today. So Dr. Roger, first of all, give us some context. What is PCOS? The name is, people say PCOS. People say, I say PCOS because it's PCOS. That's why I see.
However you do it still won't change what it is, right? So
Right.
PCOS, PCOS, all of that. That's Polycystic Ovarian Syndrome, Polycystic Ovary Syndrome, however you choose to call it. Basically, as the name implies, it's a condition that affects your ovaries, which are your part of your reproductive organs, as we all know, and then your metabolism, which basically has to do with how certain substances in your body are formed and how they are broken down. So basically to do with things that keep you alive. There are different things that have to happen in your body to be formed, to be destroyed, all of that to keep you alive. And that causes symptoms like increased hair growth, which medically we call hirsutism, acne, a lot of acne, some central obesity or weight gain centrally.
When you say centrally, like, but also...
So no. The abdominal region, the central area of your body.
Okay.
Some people also have fertility issues, menstrual issues, their reproductive issues. Some people even have hair loss, all of that. So that's what PCOS is. It's a hormonal disorder that affects, say, about 13 to 18% of women and presents with those symptoms. Yeah.
Right.
It's highly a genetic thing. Yeah. So that's what PCOS is.
Genetic meaning if somebody in your family has had it before, there's a likelihood of you getting it?
Yes. In the sense of it being, genes are passed from generation to generation. So there's that. Of course, there are also cases where in other conditions where like you can have changes happening, but that's an entirely different matter. Let's keep it a genetic. Yes.
Right. Okay, genetic, sure. This is a very serious matter. So I'll try to stop smiling so much. Yeah. But you mentioned a very important point, and I need us to clarify that, how it causes some amount of weight gain, whether central. I don't know if it's limited to just the central parts of the body, but a lot of women that present with PCOS. Is that what they say in the medical term? It presents with.
Yes. Presents with. Okay. So what basically happens is that a big part of PCOS or a part of PCOS is insulin resistance. And so what insulin, which is a hormone, for people who are familiar with diabetes, we've heard insulin a lot.
Yeah.
Yes. So basically what insulin does is insulin tells your body that store this sugar as fat, right? But then in PCOS, your tissues are resistant to insulin. So your tissues are not allowing insulin in. So what happens to your body? It's just like if I'm going somewhere and I meet someone and I'm in my hood, I'm definitely going to call area boys to come and back me.
Right.
So then your pancreas which is what actually produces insulin in your body, specifically the beta cells. But your pancreas produces more insulin to try and, overcome
That's
the
resistance.
resistance. But what this does is, one, it increases the production, or let's say the secretion, of male hormones, which are also called androgens. And then two, it causes you to store more fat. Because remember, insulin tells your body to store fat. So then you store more fat. And so what happens is now you are in a hormonal loop. Because it's like your body is resisting the insulin
also
just keeps being produced,
Right.
and then you store more fat. So now it's put you in a tough space, because now your weight loss is not simply about caloric deficits, all the usual calorie stuff and just work out and all of that. But there's a hormonal thing that's also going on that's making it harder for you to, control weight.
So does that mean that no matter what I eat to try to, because I know I've seen somewhere, I don't know if it's misinformation, that good eating habits to an extent can, and lifestyle choices, maybe resting more, can affect that insulin resistance, can affect it positively.
Absolutely. Of course, I am not saying that it's cut and dry. I'm not
Right.
saying that. What I'm trying to say is that it makes it puts you in a tougher spot as opposed to someone who doesn't have the condition, right? But then, of course, lifestyle changes really work for the majority of the people, because things like what you eat. For example, if you have a good balance of protein, a good balance of carbs, if you are sleeping well, you are avoiding stress, you are exercising more, all of these things can help you manage the symptoms. In this case, like the weight gain and all of that. Lifestyle modifications are very effective.
Right.
Most definitely. Yeah. So that's it. Yes.
Okay. Speaking of lifestyle modifications, people have expressed how sometimes it's not enough in certain cases, or in their experience, the lifestyle modifications, the exercising, the dieting does not work. Hence, medications like Mounjaro and other GLPs that are all over the internet for some reason have gone viral. And what exactly do they do in the body? How do they help for people like that?
Okay, so GLPs are glucagon-like peptide 1 receptor agonists. What they basically do is they mimic a hormone in the body that naturally helps you to lose weight. But of course, in people with a condition, these mechanisms can be impaired. And so, of course, you need extra help, right? So what basically happens is, mainly, some of the mechanisms they use is there are receptors in your brain that control how full you feel.
Right.
So these medications make you feel fuller earlier, so that you don't need to eat so
more.
much.
Yeah, right.
They help you to reset your appetite, like sort of dull your
Cravings,
appetite.
yeah.
Yes. They can also slow down your gastric emptying or your stomach emptying. When you eat, there's food in your stomach, then it has to go through a process and all that. They can slow that down so that you don't eat so much, etc. So that's basically what those medications do, and that's how they lead to weight loss. Your Ozempics, your Mounjaro, all of that. Yeah. So that's how they work.
So do they cure PCOS, or do they just help with the symptoms?
So it's a syndrome. It's not curable, unfortunately. But they are tools. They help with managing the condition, as it were. So just like the way lifestyle modifications can help, these medications can also help. Assuming you meet the criteria, depending on the severity of your condition, etc. Because you are supposed to have a certain BMI, right? I think 30 and above, if I'm not mistaken, to be on this. Otherwise, if you are at around 27, you're supposed to have certain risks and all of that. So there's definitely a criteria before people are put on it. It's not like everyone needs them. Depending on your situation and your condition and your severity, then we put you on that.
Yeah. So you just said everyone needs them. I was going to ask next, like from a medical standpoint, are these necessary for every other person that presents with PCOS because you've been diagnosed and you know you're having symptoms of, especially the weight loss thing, which seems to be a major concern for women, especially. No, of course, women are the people who have PCOS, but for a lot of these a lot of these women, right? The weight gain is a major concern because of various reasons.
Yeah.
Can we all just go and use GLP-1s?
Like I said earlier, GLP-1s are not recommended for everyone. Of course, people self-medicate and do all kinds of other things to try and, I can understand aesthetics matter quite a big deal to people.
Right.
But there's a criteria. You see, in the medical world, you don't just get up and then give anybody anything.
Right.
You need to have indications, or someone needs to fit a certain criteria before you put them on. So for most people, like I've said, lifestyle modifications would help a great deal. But of course, depending on the severity of your condition, the extent of obesity, for instance, using the BMI,
okay.
etc., then you know whether to put this person on that or whether not to put this person on that, etc., etc.
So if the person doesn't meet those criteria from a medical standpoint, for instance, if I decide to go and buy Munjaro because I have access somehow, whatever they are doing and they're getting their Munjaros, and I don't meet that criteria, does that mean I get adverse effects beyond the side effects themselves? And what are even the side effects? That's a double-barreled question. I'm
Okay.
sorry. Yeah.
So every medication has side effects. In fact, there's a quote that most people, when doing pharmacology, either as in the healthcare space, are usually used to, right? It's that every drug, well, I'm paraphrasing, every drug is a poison. The difference is in the dosage, right? Basically, I'm trying to apply that here, although it might not fit per exactly. The thing is that every drug has side effects, and even more so, you're at a disadvantage when you don't have indications for using that drug. Naturally, the side effects of these GLPs are, most of them are the stomach issues: nausea, vomiting, diarrhea, constipation, stuff like that.
Are these short term?
These are short term. You can also have longer. Well, these are being studied anyway. GLPs are a relatively newer group of drugs. So the longer term effects that are being studied include stuff like pancreatitis. Remember, the pancreas is what produces the insulin.
Yeah.
So can have a little bit of inflammation and all of that, and that could quite become a very big issue. You could also have some issues with your gallbladder. If you remember from basic school science, the thing that secretes the bile and then emulsification of fats and all of that. Yeah, so you could also have some issues with that. Those are the long-term things that are being studied at the moment. So yeah, I wouldn't advise people to be on them without like consulting a physician. Yeah. But definitely, of course, there's always the risk of side effects. Every drug has some side effects. Yeah.
So there's some backlash online around the idea that people who might not be able to afford, because beyond prescription from doctors, now my doctor says I should get Mounjaro and I cannot afford it.
Yeah.
What's next for me? Right?
Yeah.
If you cannot afford it and you have, what can you do next beyond affording Mounjaro if you can't?
So one of the things that every doctor, I believe, or every good doctor, in my opinion, does is that we always try to evaluate whoever it is that we are seeing.
Right.
So there's a portion when we are talking, when you go to the hospital and the doctor is asking you questions, there's a portion of it called the social history. We ask you stuff like, what job do you do? Do you live with anyone? Where do you live? Stuff like that. It gives us a bit of an idea into who we are dealing with,
Right.
so that we know that if you can't afford this, then there's another option.
Right.
Or there's this. We would always try to give you alternatives. It's not like everything is set in stone, because a big part of the job is being empathetic
Right.
to whoever it is you're seeing. So it is not like a death sentence or anything, so as to speak. Um, you can be on lifestyle modifications, like the diet, the exercise, the getting enough rest, the psychological support or mental support, etc., all of that. And then you can also, there are even drugs like metformin, which have been in the system for longer, right? That help with the diabetes-like symptoms, the
Right.
insulin control, and all of that. There are options to explore that. So it's not necessarily GLP or nothing. There are always options. There are alternatives that you are going to try and then try and keep up with.
I love that bit. It's not GLP or nothing. I would love for us to rehash it
Oh yeah, but
somehow,
it's not
because
GLP or
for
nothing.
some reason, a lot of people who have PCOS that I'm meeting these days, because
Yes.
as a lady, I definitely have friends who would have dealt with this in some capacity,
Yeah.
think that I need to get Munjaro is a magical solution to my problem and
I
the weight gain. And oh, Munjaro, oh, Ozempic.
I think one of the hardest things these days when it comes to especially medical conditions like this is there's a lot of groupthink,
Right.
one, and two, everybody believes they are an expert these days because there's AI to quickly Google or something,
Right.
and people don't take time to appreciate the nuances or be fully informed about things.
Right.
They see something that supports their confirmation bias. Like they just have some confirmation bias. Oh yes, I saw this. What I'm
That's
thinking is
right.
true. That's all. Bam. And then everybody has an MD online these days. But I think we owe it to ourselves as people to be better informed about what we choose to put into our bodies, one, even from medical professionals. Ask questions. And I've noticed this. People don't like to ask questions. Ask questions. When you go to the hospital, ask questions. If you have PCOS and you're being evaluated for it, ask questions. When they put you on contraceptive pills, ask questions. Why am I being given this? What is the problem? What is this going to do? What do I expect to get from this? What are the side effects? If I do this, what should happen? When should I come to the hospital again? How do I know it's working? All of these are things you could ask.
Can you though? Because sometimes when you're dealing with certain, in my experience, some of the medical,
Yeah.
when you're asking too many questions, they make it look like you're being annoying. I don't know if it's because of the queue outside or
Well,
whatever.
that could impact things because like we are understaffed in this country, etc. So maybe like you have a lot of people to get to, and etc. But I feel like no, I mean, sure, it may seem annoying to certain people, but wait. Just like in the GLPs, we would weigh your therapeutic benefits
Right.
or the advantages to you to the side effects.
Right.
Wait, annoyance, being very sure about what I'm taking. Which one is more important? Oh, the doctor's ego is more important, then it means this one comes down.
Right.
If mine is more important, then it means I'm going to place less emphasis on the annoyance. And at the end of the day, the person that should benefit the most in that interaction is you,
It's
the
you.
patient.
Right.
So you always have that at the back of your mind. It's not GLPs or nothing. People need to understand that. And I think there's so much pressure. People are seeing results from popular people and all of that, and people are being pressured into wanting something or nothing. Yeah, so there's a lot more education that needs to be done. There's a lot more questioning that needs to be done when they are being taken care of at the various facilities.
Thank you so much for hammering that. And it's not GLPs or nothing. Calm down. Calm down. Breathe in, breathe out. It's not GLPs or nothing, right? There are so many other options, like Dr. Roger has explained. But when we say lifestyle management or lifestyle changes or modifications, people are like, oh, I've been dieting, I've been exercising, it's not working. How do you respond to those people? Because that was one of the major comments we had. It was, oh, how can you just say that, oh, I should exercise? I've been doing it, it's not working. What can they do aside exercising and dieting? Is there a long-term way of managing PCOS and its symptoms?
So you see, one thing that's a big issue when it comes to patient care. One of the very, very big issues we have in healthcare is compliance. And no, I am not victim blaming before anybody tells me I am victim blaming. I kid you not. I've literally given advice to someone who suffered with a chronic condition before that please cut down on your eating, eat healthier, avoid more fried stuff, etc. And I saw the person there's a spot in the place I work at eating salad. And I mean, sure,
Ghanaian salad.
there were greens in there and stuff, but when I saw the amount of, those starkest
Cream.
in there with the oil, and then I'm like, you know, sometimes I feel like maybe we need to be more specific. If we say whole grains and all of that, because sometimes people think they are eating healthy. Oh, a salad, yeah, may lose weight, yeah. But then there are different things that go into the making of the salad that might work against you.
Right.
Right. So be sure you're doing the right thing first of all. Your omega-3s, your legumes, your greens. Get a good portion of protein. Control your carbs, stuff like that. Aside the eating as well, the exercising. Are you sure you're doing it well? Are you being consistent with it? Are you sleeping right? Are you trying to alleviate your stress, or you're always just that kind of thing? Are you getting good mental help? Because mind you, mental stress is also a big deal. If you need therapy, get therapy, all of that. And if you are so sure you're doing all of these well, go back to your physician and let him know that I have done all of these. And so far, maybe I'm not seeing the results I want, or I don't really think this is working. And then, explore other options available to you.
Right.
Yeah. So please, before you come and tell me that the doctor said we don't know how to exercise or how to eat, I gave a caveat. You can do that. Make sure you're doing it well. If you are sure you're doing it well, escalate it. Go back to your primary care doctor. Talk to your doctor. Tell him, I've done all of this. This is not happening. And let's see what's the way forward now. Don't. It's your health. It's very important. So please, don't whine about it privately or to your friends. Go and see the doctor. See the professional. Let them know your concerns.
Right. So just to recap the discussion so far.
Yeah.
The key points: GLP is not the only solution. It's not the first solution you should think of, really.
Yes.
Except if your case is very extreme or your symptoms are very extreme.
Yes.
There are other alternatives.
Yeah.
And that includes lifestyle management modification, exercising, dieting properly, being consistent with them.
Absolutely.
Then going back to your physician or your primary care doctor to present them your concerns about whether or not it's working, then you can explore other options. So your first solution shouldn't be GLP. It's very important to me because people do not agree that lifestyle changes are enough for some reason. Are enough to manage some of the symptoms they have to deal with. The weight gain particularly, because that's what seems to be a concern for a lot of people.
I also think sometimes the pressure comes from the timing. People want fast and quick results.
Right.
And I even see this I don't go to the gym anymore, so you can see. I don't go there anymore. But I mean, when I used to go to the gym, there were people that would come for especially when New Year's comes. People come for a week.
Newborn.
Then, or 2 weeks, then when they gym and they see the immediate
pump.
Games, the pump in the mirror, then they take the snaps. Then 2 weeks later, they are nowhere to be found. I think that also applies in this case. I feel like sometimes people feel like the GLPs will give them instant results, and as opposed to the sort of hard work. But like you're saying, everything is in stages.
Right.
We don't need to rush to an end point because, of course, they also have their side effects and all of that. So just see a doctor, let them tell you what to do, ask your questions, do what you can, step by step, systematically. Yeah. So that's it.
So, in conclusion, is it sound for me to say that medically,
yes,
while some medications might help. They are not the only way of managing certain symptoms of PCOS.
Absolutely. They are not the only way. They are simply adjuncts at certain stages.
Right.
They are not the only way, and they are not first line.
Right.
There's no medical professional in the world, in my opinion, that would disagree with what I'm saying.
Right.
GLPs are not first line.
Mm.
First line is always lifestyle medications. It's the same with other chronic conditions. Nobody is going to instantly put you on drugs for hypertension when they think you are having. No, they are going to first tell you to have some lifestyle changes and all that and see. Yeah, there's lifestyle changes. There's a first line for things. Drugs are not always the solution.
Right.
GLPs are not always the solution for PCOS. They are not the first line. Yeah.
Thank you so much. I mean, we mentioned other symptoms. Just to go back to that, you mentioned hirsutism.
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 Yes,
Hirsutism. We'll put this on the screen.
And
Hirsutism.
acne as well.
And acne.
All of that are from the androgens.
Right. How do we manage those? Because we mentioned weight loss a great deal in this conversation. How do we manage those things?
So this is where things like contraceptive pills come in. And I think, well, I've been on Twitter in a while, but back then I think I came across some issues with that as well. People have their own issues with that.
Right.
And while I do understand that patients are not a monolith and people have different genetics and how they respond to things in different ways, everything that's done in medicine is from an evidence-based point of view. People conduct different research, meta-analysis, all of that before they do this. So this is what happens. There's a hormone in your body called the sex hormone binding globulin, SHBG. And what happens in PCOS is that, so what the SHBG does is that it binds to your, how best to say it, let's say it mops up your androgens.
Right.
Right? The male hormones, the things that cause the acne, the things that cause the hirsutism.
Right.
So when you give estrogen or progestin only pills, like basically contraceptive pills, what happens is that you increase the ability of this SHBG to bind to the androgens.
Right.
So it's like you are mopping up more androgens
to reduce their level.
So that it doesn't give you so much of the acne and the hirsutism. Yes,
right.
Hirsutism. Yeah.
Interesting stuff. And so beyond, okay, and that would mean your doctor would probably prescribe those contraceptive pills to you.
Yes, definitely. I'm sure most people who have had PCOS have. I was about to say PCOS. I didn't know why I backtracked and said PCOS. Anyway, one of them is right. So yeah, most definitely contraceptive pills would be prescribed for you. At stages, depending, of course, on your condition.
Right.
As it were. Yeah.
I mean, you've heard all of that from Dr. Roger. Does not mean he's prescribing it to you.
Yeah.
Yeah. Listening to the fact that yes, contraceptive pills might help in your case or whatever, does not mean you should go and be buying contraceptive pills and all of that. Yeah. There's a sect of people who believe that a lot of their ailments have herbal solutions. They can eat from the earth or combine something or even buy existing herbal drugs that are marketed so much in the media and that can help them. Does PCOS have a herbal solution? I'm sorry, you're a doctor, but
yes.
Yeah.
Oh no worries. I can answer that. Currently, according to literature, no. I have seen some studies on inositol, I believe, but there's nothing conclusive.
I don't know what inositol is.
There's nothing conclusive.
Right.
That is the answer to the question. There's nothing conclusive, and I would do well to sound this caution to patrons of herbal medicine.
Right.
Herbal medicine in itself is not necessarily bad. Okay, because I mean, for example, where I trained, we had an institute of traditional and alternative medicine. But herbal medicine that's not subjected to science is dangerous There's a reason why science is science. You have a hypothesis, you conduct some research using a certain method which you document, you have certain aims, you get results. Those results are replicable across anywhere in the world once you go according to the same method. And that is why we are able to say, oh, okay, then this does this, and everybody uses it. Most of these herbal things are things that have not been tested enough, one. So you are risking your own body when you decide to go on that path. Because at the end of the day, most of the time, people end up coming with kidney failure, liver failure from these unapproved herbal medications. So at the moment, I do not know of any herbal medication that helps with PCOS.
Right.
Yes.
He does not know. He
Yes.
does not know of them. I also do not know, right? They might say one herbal medicine cures 10,001 ailments from your headache to foot
And I
pain.
mean, it's funny. Anyway. No, you see, this gets me very passionate because there's a popular account on Twitter that I banter with all the time when I can. Well, name withheld. No, not name withheld.
Name withheld.
Not name withheld. No, not name withheld. Not name withheld. Not name withheld.
When they go low, I go lower.
The handle of the account is Chief Herbalist. And one of the most ludicrous claims to me was there was another genetic condition, sickle cell. It's something that we've all heard about.
Yeah.
Do you know what happens in sickle cell? They are amino acids. And then one of them gets changed because of a mutation.
Right.
Okay, from a different position to another position. Everything you are as you're sitting here is because of proteins and how they are coded in your body.
Right.
And then this guy says that when you blend some leaves and then drink it, it's going to go and correct that mutation. Like the proteins are going to see the juice or whatever come in and be like, hey, you know what? I'm going to switch. It's absolutely ludicrous
Right.
that people say these kind of things. And they're supposed to be a herbalist. I don't know where he got his certification from, but I don't think if you understand the pathophysiology of anything, especially that disease, you could say things like this. And that once again brings me back to the education. Educate yourself, like know what you're dealing with. If you know what you're dealing with as a person, when people say certain things, especially about unapproved herbal medication, you just be like, nah. Because I kid you not, this guy can be like, oh, blend this, blend that, blend this, blend that, drink this, you are healed. Drink this, you are healed.
And people
I
will
kid you
try
not,
it.
people are under the comment section asking for where they can come for consultations, all of that. And it is rather sad, you know. I mean, if you have proof, when you post your thing, add the evidence. Because I know whatever I tell my patients or whatever health education I do online, I have sources to back it up.
Right. It's a world of evidence.
Yes, evidence-backed medicine.
Yeah.
That's what should be. So please, do not put your faith into the hands of herbalists that is using unapproved methods. Don't do that. Research for yourself. If they give you something, research for yourself and see it. Herbal medicine is not bad, but unregulated herbal medicine is bad. So do that. Yeah.
Thank you so much, Doctor. Please, before you leave, I want us to break this conversation into granules for people, key points that they should take away from the conversation. From people who have PCOS, what they should be looking out for, things they should be doing like research, and if their symptoms seems to defy the lifestyle modifications, what they should be doing. You know, key things they should leave this conversation with. Can you do that for us? And let's wrap this conversation up.
Okay. People have menstrual irregularities. Some have anovulation. Okay, so some people don't have their period every month. Sometimes you go 3 months, it hasn't come. All of that. It could be a hormonal problem. It could be PCOS. You realize you are very hairy for a woman. It could be PCOS. You have realized that you're having some central obesity, usually more weight gain around your center, the center of your body, your midsection. Could be PCOS. Acne, a lot more of acne. It could be PCOS. So these are some of the things to generally be looking out for. These are some of the symptoms. So you should go see a doctor. They will let you do some tests, of course, some hormonal tests and all of that to see, maybe even do an ultrasound as well, an ultrasound scan, which might see things on your your ovary, right? You may be having some fertility issues as well. All
Oh,
of
sorry,
these
not to cut you. Speaking of fertility issues, does that mean when you have PCOS, you have those fertility issues, you might not be able to give birth at some point?
So it's not a one size fits all.
Right.
It depends on the severity of your condition, one. And of course, there always will be alternatives. So, you should just speak to your doctor, your
Right.
fertility doctor, or whoever it is that's taking care of you. There are always ways around certain things.
Okay.
Some people may have more difficulties than others, and that's just how it is. So when you have those symptoms, go see a doctor, you do some tests and all of that. If you do, it turns out that you do have PCOS, of course, suggestions will be made to you, lifestyle modifications amongst others. You may be also taking some pills, for instance, to sometimes regularize your cycle, as
Right.
it were, in those that don't have regular cycles and all of that. And then depending on the severity of the conditions and how things progress, other therapeutic endeavors such as GLPs may be introduced as and when necessary.
Right.
But it's not conk that, hey, I have PCOS, so it means
Take
GLP.
GLP.
No,
Right.
it's that's not true.
Okay.
Yeah,
Thank you so much.
you're welcome.
All right. We've just had a very insightful conversation with Dr. Roger, who has shared with us a lot about PCOS or PCOS, like people say, symptoms, what you should be looking out for, what solutions might be for you depending on how severe your situation is. You have PCOS doesn't mean you should start looking for GLP illegally. Highlight that illegally, because for some reason people are importing. It's crazy on TikTok. I'm seeing people saying DM me for Munjaro. What do you mean DM you for Munjaro? Hello. I think there should be like law regarding those things, really. Yeah, so Dr. Roger has shared with us a lot of things. I've tried to list them, but go back, watch this video. If you haven't watched the full video, share it, leave your comments, share your questions. And if we can, we might bring Dr. Roger back on the LAFA Babes show. Nasiba was not here, but as you know, my name is Seraphine. See you in the next one. Like, comment, share all the things that you have to do. You do them. Okay. Bye-bye.